a pilot with the London Ambulance System and the West Midlands Ambulance. They are now introducing a new system which everyone should be aware of for recategorising or dealing differently with Category 2 emergency calls. So Category 1 calls, when you phone 999, are when there's an immediate threat to life. So you'll be asked if the person is unconscious, if they're breathing, and what happened. So that is your ones where they're blue lit out, you're a really high emergency, and that person is likely to need resuscitation or immediate care. Category 2 are for life-threatening emergencies. So things such as burns, stroke, heart attack, epilepsy, sepsis, they're all Category 2 emergencies that sit in that. Now, stroke and heart attacks will still go in and be treated immediately on that triage system as a straight Category 2 emergency. But about 40% of the other Category 2 calls are going to be now looked after in a different way. So for the other people that are having a serious injury or illness, they will be triaged. So there will be more clinicians within an ambulance control room, and they will then be talking to the patient, usually as a callback, and they will be having a discussion and helping the patient or whoever's looking after the patient to make sure they're treated in the most appropriate way. So it might be that they keep their place in the ambulance queue, and that they do need that emergency and that level of 999 help in their home. It might be that they are reassessed and maybe they are put higher up or not. And it might also be that they're redirected to somewhere else that can help them better. So maybe they can get themselves to a hospital or an urgent care unit, or maybe a GP can actually help once they get to speak to the person. Maybe the burn that they have isn't as serious as it might be, and they can be advised on immediate first aid and how to get the help that they need. So they're hoping that doing this new approach is going to be much better for patients. So it will give you the more appropriate care. It will also take some of the pressure off the ambulance service and make sure that we're using the ambulance service right. So we're using them when we really need them and not as a taxi service to get to a hospital, which unfortunately some people are. Now, Category 3 level are people that it's urgent. So it's people who are having abdominal pains, late stage labour, less severe burns, people with diabetes. They will still be treated as they always have been. And Category 4, which are less urgent, people will be categorised and then advised where to go to get the most appropriate care, because it probably isn't to get an ambulance and get to A&E. So this is all good news. It's good news for patients. It's going to be better to have more clinicians within the ambulance control room, and we should be getting far better care and prioritising the ambulances for the people that really need them. So please let other people know. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.